and there are no other special precautions that she needs to take at this time. We complete a full assessment of Terry. In addition to the bilateral swollen tender joints, weight loss, fatigue, she also has other manifestations of rheumatoid arthritis, such as joint deformities and a fever. Joint deformities and subcutaneous nodules are common in rheumatoid arthritis, and the fever is also common. Usually you have a persistent low-grade fever with rheumatoid arthritis because it is a local and systemic inflammatory disease with many generalized symptoms such as the fever, fatigue, weakness, along with multiple lung, cardiac, and renal manifestations as well. We assess the findings for Terry, including her stiffness and swelling of her wrists and elbows, and note that she has a decreased range of motion in these joints. On palpation of the joints, we note that the joints feel somewhat soft. Terry has indicated that she has experienced a slight fever, rundown feeling, and loss of appetite that resulted in her 5-pound weight loss. Her healthcare provider prescribes the following medications: buffered aspirin 500 milligrams PO daily, Rid-Ara 6 milligrams PO daily, and Mexate 2.5 milligrams PO every 12 hours for 3 doses, and then 7.5 milligrams weekly. We are aware that the aspirin is a excellent inflammatory, antipyretic, and has analgesic properties. However, it has potential to cause significant side effects and toxicity. So we will monitor her for that. The signs and symptoms of aspirin toxicity are ringing in the ears and confusion. Over the next several months, Terry returns regularly to the clinic for ongoing management of her RA, but her pain, fatigue, and joint mobility continue to worsen. She cries now during every visit and expresses that she can't take care of her children without help because of her physical limitations. We establish a plan of care for Terry based on the following priority nursing diagnoses: pain related to inflammation, impaired physical mobility related to pain and reduced joint motion, impaired parenting related to physical limitations, ineffective coping related to dependence on others. And also, in addition to her nursing diagnoses, we include other information when teaching her to manage her chronic pain, such as applying warm packs to her affected joints. Heat applications will increase blood supply to the joints, decrease her pain, and increase her mobility. Cold applications may be used, but primarily those are just for acute pain flare-ups.
All right. For the next 2 years, Terry experiences several exacerbations of her symptoms, followed by lengthy periods of remission. During a routine visit to the clinic, Terry states, "I'm having more bad days than good days lately. My knees are swollen and painful, and it's hard to walk. I'm spending all my time in this wheelchair. I just don't think life is worth living if I have to live like this forever. All I can think about is how my children don't have a mom anymore. My husband has to do everything. What is the point of trying anymore? They would be better off without me." Terry continues to say that it's so hard on my husband, it seems like I have no option in my life. So we propose the option of surgical joint replacement. After further discussion with her husband and ourselves, Terry expresses her interest in learning more about the possibility of joint replacement. After consulting with a surgeon, she decides to undergo bilateral knee arthroplasty. For post-operative intervention, following her surgery, Terry is transferred to the surgical nursing unit. She is placed on a continuous passive motion machine to help begin her rehabilitation. For her post-operative intervention, it is important that we empty drainage from the suction device and record the output. We perform a neurovascular assessment of Terry's feet every 2 hours, checking for pulses, make sure there's no paralysis. Terry's healthcare provider prescribes morphine via PCA pump with a demand dose of 1 milligram and a lockout interval of 10 minutes. A PCA via IV infusion is used to allow these clients to give themselves the pain medicine. Terry can receive analgesia more rapidly, which makes her feel more control of her pain management. We tell Terry that the pump is there and it helps prevent her from having an overdose. 4 hours later, Terry notifies the nurse that she is having pain in both of her knees, even with the PCA pump. Terry reports that the pain is an 8 on a scale of 1 to 10, with 10 being the worst that Terry has ever experienced. We then go in and assess Terry and rule out any other complications.
Okay, so on her second post-op night, Terry's IV is converted to a saline lock and her PCA pump is discontinued. She is started on Lortab by mouth every 6 hours PRN. Terry reports that her incisional pain is now a 6 out of 10 during her physical therapy, despite receiving her analgesic prior to the scheduled therapy. The evening of her second post-op night, the UAP reports that Terry is complaining of extreme fatigue. She has asked for several additional blankets and told the UAP, "Just leave me alone. I don't feel good. I'm so cold and my knees hurt terribly." Our assessment findings include that her temperature is 103 degrees Fahrenheit, her pulse is 132, respiration is 18, blood pressure 102/56. Terry complains of having chills and increased incisional pain. Her breath sounds are clear, her OT sat is 97 on room air, her surgical dressings are dry and intact, and her pedal pulses are 2+ bilaterally. Her capillary refill is 2 seconds in both feet. We notify the surgeon of the changes in her condition. Terry's infection is successfully resolved without the onset of septic shock, and she is preparing for discharge. We include a review of crutch walking techniques in the discharge teaching plan. Terry is discharged from the hospital, and when her husband and children arrive to take her home, the older children excitedly tell Terry how they have helped prepare her room. Terry will receive post-op care from the home health nurse until she is able to resume her regular visits to the healthcare clinic for management of her RA. So, thanks for watching. Study for the test. See y'all Thursday.
Good luck, Terry.